Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Education Ministry develops online module for compiling out-of-school children's data identified by each state and union territory. Nagaland launches Pneumococcal Conjugate Vaccine for children below 5 years of age in the state under Universal Immunization program. Nagaland to get second batch of 56,810 COVISHIELD vaccine procured by the state government. And Naga Students Federation appeals telecom service providers to improve network connectivity. As many states are relaxing lockdown norms, we advise our listeners not to lower their guard as the COVID-19 pandemic remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow the 4 simple steps: wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline numbers 700-55-39653 and 1800-345-0019. And now the news in detail. Education Ministry has developed an online module for compiling out-of-school children's data identified by each state and union territory and map it with special training centers on the Prapan portal. Union Education Minister Ramesh Pokhriyal Nishank has informed that child-wise information of the identified out-of-school children and special training centers for them will be uploaded at block level under the block resource coordinators. He said a quarterly progress report and a user manual had also been shared on the Samagra Shiksha portal in order to assess the scheme on a timely basis. Nagaland has become the 8th state in the northeast to have introduced the Pneumococcal Conjugate Vaccine (PCV) for children below 5 years of age in the state under the Universal Immunization program. Principal Director of Health Department Dr. Nikrele Kimiao officially rolled out the statewide PCV today at Primary Health Center, Kohima Village. Dr. Kimiao said vaccines are the most effective way to prevent any infectious diseases. He said infants and children are prone to many diseases, especially pneumonia, and as such, the new vaccine, BCV, is developed to help protect the children. He said the world have been combating with serious, potentially deadly diseases since decades. However, it could be defeated with vaccine. Dr. Kimiao said when disease like smallpox could be prevented by vaccine, it is necessary for all to get vaccinated for COVID-19 while following all the COVID-appropriate behavior. State Immunization Officer Dr. Ritu Toor said the new vaccine BCV is to prevent deaths among the children under 5 years of age against pneumococcal disease. He said the route of infection is through droplets like coughing and sneezing. He said a vaccine is available in a liquid form, which is injectable. He said a child will be immunized with scheduled 3 doses of BVC at 1.5 months, 3.5 months, and booster dose at 9 months of age. Dr. Toor expressed hope that with the introduction of this new vaccine, the state will move forward in improving the immunization program. The BVC is provided free of cost in all the government health centers of the country. State Immunization Officer of Health Department Dr. Ritu Toor said Nagaland is getting the second batch of 56,810 COVISHIELD vaccine today procured by the state government. He said the state got 36,850 vials during the first procurement. Dr. told AIR News Kohima that the department has set a target of daily 16,500 vaccinations per day during the 10 days of intensified vaccination drive in the urban areas. He said the department is planning to cover at least 30% of the first dose to 18 years and above within this month or by first week of July. He hoped that by October the second doses will be covered so that 50% of the population is fully immunized with the COVID vaccine. When asked about low vaccination coverage among the 45 years and above, Dr. Toor said that data available for these age groups continues to be low and said these age groups are probably stubborn. In this regard, he said the department has written to all the district task force to conduct more robust activities on advocacy and awareness among the faith-based organization, NGOs, and said Mon and Moguchung districts are performing well in carrying out the importance of vaccination. Dr. Tur said COVID deaths in the state were also attributed amongst those who were not vaccinated. He also dismissed the rumors, fake news, and religious misinterpretation on COVID-19 vaccine, adding that one should not be carried away. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Naga Students Federation NSF has expressed dismay over the continued negligence of telecom service providers for poor network connectivity in the region. In a press release, the NSF said the student community has to rely on internet connectivity with the introduction of online academic classes, webinars, and teleconferences. The NSF appealed to the telecom service providers to immediately rectify the problem by providing quality network coverage and uninterrupted internet connectivity in all areas of operation in the state. Deputy Commissioner Kohima has issued additional relaxations within Kohima, which will come into force from tomorrow till 18th June. Permitted shops and business establishments will be allowed to open between 6 a.m. to 2 p.m. However, main market areas in POC High School Junction will still remain closed. Hardware and electrical shops, shops selling stationaries, mobile phones and computer accessories, garages for automobile repairing, and shops selling vehicle spare parts will be allowed to open on 12th, 14th, 17th and 18th June between 6 to 2 p.m. Restaurants or eateries will be allowed to operate takeaway or food delivery, while groceries delivery and other e-commerce service providers will be allowed to function. All other activities which are not permitted will continue to be strictly restricted. Further, all permitted activities should ensure all COVID-appropriate behavior, and failure to comply with their directives will be deemed to have committed an offence punishable under relevant provisions of the Indian Penal Code. Movement of private vehicles, including taxis, will be allowed to ply within Kohima district on odd-even basis except Sundays till 18th of June. In an order issued today, Deputy Commissioner Kohima said vehicles with registration number ending with odd numbers 13579 will be allowed to ply on Mondays, Wednesdays and Fridays, while vehicles with even registration numbers 2468 and 0 will be allowed to ply on Tuesdays, Thursdays and Saturdays. The DC informed that taxi drivers will have to produce negative COVID-19 report not earlier 72 hours from the day of operation. Taxis desiring to resume operation will have to report to the team of Regional Transport Officer, Kohima, through mobile numbers 9366 221563 or 9862 159833. Violation of this directive will be liable to penalty under the Motor Vehicle Act 1988. Health workers and staff nurses of Kitsopozo Sub-Center under Urban Primary Health Center Sikazo today conducted massive COVID-19 vaccination drive for the residents of Kitsopozo, Ward No. 5, Kohima, at the Panchayat Hall. Kitsopozo Panchayat Chairman Vimhalye Benner informed that altogether 183 eligible persons were inoculated with first dose of COVISHIELD. It includes 174 persons in 18 years and above and 9 senior citizens, with a 90 years old man being the oldest beneficiary. Meanwhile, Unit Family Welfare in Police Reserve Supply Colony, Dimapur, conducted COVID-19 vaccination drive today. Commissioner of Police Rotihar said that it is the choice of an individual to get vaccinated. He, however, said false advocacy against COVID-19 vaccine will lead to criminal offence. And now, 20 News, here are the main points again. Education Ministry develops online module for compiling out-of-school children's data identified by each state and union territory. Nagaland launches Pneumococcal Conjugate Vaccine for children below 5 years of age in the state under Universal Immunization program. Nagaland to get the second batch of 56,810 COVISHIELD vaccine procured by the state government. And Naga Students Federation appeals telecom service providers to improve network connectivity. That is all we have in this evening news bulletin. Good night.